Topic Area 3. Acute injuries, fractures and dislocation. A fracture is a partial or complete break in a bone. It is an acute injury. Fractures are usually caused by sudden trauma, such as an awkward fall or bad landing, or impact with another player in a tackle or collision. Fractures are more common in contact sports. For example, football players may suffer broken legs, and basketball and netball players are prone to broken fingers. Open. An open fracture is one where there is considerable damage to tissues because the fractured bone has broken through the skin. Open fractures have a high risk of infection. Closed. A closed fracture is one where there is relatively little damage to the surrounding tissues because the bone has hardly moved. Dislocations. A dislocation is an acute injury that occurs when a bone slips out of position in a joint, usually when a joint suffers an unexpected or unbalanced impact. This might happen if you fall or experience a severe blow to the joint during an activity. It is possible to dislocate almost any joint, including knee, hip, ankle, and shoulder. Since a dislocation means a bone is no longer where it should be, medical attention should be sought as soon as possible. An untreated dislocation could cause damage to ligaments, nerves, or blood vessels. Initial treatment for any dislocation involves price, protection, rest, ice, compression, and elevation. In some cases, the dislocated bone might go back into place naturally after this treatment. If the joint does not return to normal naturally, it may need to be manipulated back into its correct position.